One, two, three. Start now.
Hello, I'm Dr. Amani Musa, one of the surgical doctors. Can you confirm your name and age, please?
Hello, doctor. My name is Susan. I am 65 years old.
Nice to meet you, Mrs. Susan. I need to ask you some questions regarding your condition. Are you okay with this?
Yeah, that's fine, doctor.
Could you please tell me what brought you in today?
I had abnormal movement in my hand, doctor.
I'm really sorry to hear that. Could you please tell me more about this?
Of course, doctor, to be honest, I have had a couple before, but recently I experienced this, doctor, started suddenly in my right hand.
Mhm. When it happened?
It happened at home a few hours ago while watching the TV. My arm started shaking uncontrollably, and I fell to the ground, doctor.
Uh-huh. I'm really sorry for that. When you fell to ground, you hit your you hit your head.
Yes, doctor.
Mhm. Did you feel anything? What did you feel immediately before the episode? Any warning like chest pain or feeling anxious, like something will happen?
Nothing, doctor. I just fell and I didn't experience any of this.
Mhm. Did you lose your consciousness?
Yes, for a while.
Do you know for how long?
No, doctor. But my husband witnessed
Uh-huh.
the event.
Okay. How he described it?
He said I fell suddenly and started shaking, so he called for help.
Uh-huh. Uh-huh. Did you bite your tongue
No, doctor.
or wet your clothes yourself?
No, no.
Mm-hmm. Okay. Did you notice any excessive eye blinking?
No, doctor. But after the word, I
Mm-hmm.
confused and tired.
Uh-huh. Okay. Did you feel that your eye deviating outward?
Could you please repeat your question? I'm sorry.
Did you notice that your eye deviated outward, like rolling up?
No.
Mm-hmm. Okay. Did you have any episode before like this? I think you said
Yeah,
before.
I
Yeah.
answered this question previously, doctor.
Mm-hmm. Yeah, you said this is you have couple
I
times.
have
This
a
is the
couple,
third time, right?
yes.
Yeah, I only want to confirm that. Sorry.
Okay, no
Um,
problem.
could you please tell me the frequency of your episodes? How many times per week?
Uh, it's not by week, but it care about 3 times per month. But getting worse recently, doctor. I feel this much
Mm-hmm.
recently.
Mm-hmm. Okay. And when it has first started, exactly the first episode when?
I cannot able to remember, doctor, but it is about 6 months or 7 months ago.
Mm-hmm. Could you relate it to events like sleep disturbances or consumption alcohol?
No, doctor. But I am smoking.
Mm-hmm.
I am heavy smoker, doctor.
Uh-huh. Uh-huh. How many cigarettes per day?
It is about 2 bag, about 40 cigarette per day.
Uh-huh. Did you notice any unintentional weight loss?
Yes, doctor. I lost about 4 kilo in the last 2 months.
Uh-huh. Okay. Really sorry for that. And any loss of appetite?
Yeah, doctor.
Mm-hmm. Any fever?
No, I didn't experience fever.
Any neck stiffness?
No.
Any history of trauma to your head?
No, doctor.
Do you see your GP for any other medical condition?
Yeah. I had hypertension and diabetes, and I am on regular medication for these conditions. Lisinopril and metformin.
Could you tell me about the dose?
I'm not aware about it, doctor. Sorry.
Okay. You did any operation in the past?
No.
You have allergy against any medication?
No, I have no allergies.
Okay. Any family history of similar condition in your family?
No, doctor, no.
Time finished, 6 minutes. Okay, doctor, can you present your patient, please?
Okay, I will. Sorry, I will present Miss Suzanne, 65-year-old lady, presented with right hand fitness, with I started few hours ago at home while she was watching the TV. This is her third time. Her complaint started 11 months ago. She had a history of unintentional weight loss, about 4 kg for the last 4 months, a loss of appetite, and she's a heavy smoker, but not alcoholic.
All right. So, what's your most appropriate differential?
What's my most appropriate differential? This could be epilepsy, but also I will consider brain tumor. I will consider infection like meningitis, encephalitis, or also I will consider head injury, head trauma.
Okay. And what's your investigation? How will you investigate this lady?
Okay. I will start by general blood investigation, like CBC and blood sugar and AVG and electrolyte, calcium, magnesium, sodium, potassium, and CRB, and also I will take LB. Then for imaging, like CT head for trauma and MRI with gadolinium stain and EEG.
Okay. What else?
AVE, I said.
Yeah.
CT brain, yeah.
Okay. How will you treat your patient?
Yeah. Firstly, I will treat the acute condition. Abortion of the, if in acute condition, I will abort the seizure as care of critical surgical patient following ABCD approach. I will take the safety of the place and put the patient in left lateral position and give high flow oxygen and give benzodiazepine, lorazepam, or diazepam. And then I will take blood investigation like ABG and CBC electrolyte and blood sugar. Then I will treat the cause. If it is brain tumor, can be treated through the debulking of the tumor.
All right. Can you mention 4 of the anti-epileptic medication that may use for epilepsy?
We can use diazepam.
Time is finished. Yeah, but finish your answer.
Diazepam, lorazepam, phenytoin, barbiton, thiobinton. Barbiturate.
Okay. Valproic acid or valproate, fine.
Sodium valproate.
Yes. Define status epilepticus.
It is epilepsy more than or equal 30 minutes or non-regain to consciousness after.
Sorry?
It is epilepsy. Is status epilepticus. It is active seizure equal or more than 30 minutes, or non-beginning to consciousness to conscious after seizure for more than 30 minutes.
Okay. All right. Good presentation, Amani. There's seizure by itself is a very difficult station, to be honest. And I wish none of you have this history of seizure. It's not easy, it's very complicated, and it has a lot of stuff going on. Firstly, today, first mistake you did, Amani, you didn't introduce yourself.
No, I introduced.
You said, we have this recorded, I'm going to review it later, but either you didn't introduce yourself or you didn't take permission, one of them, 100%.
No,
Muhammad.
no,
Yeah, she introduced
did both.
herself. Hello,
Yeah.
I'm Dr. Amani, one of
And
the
I
surgical
said I
doctor.
need to ask you some questions.
Yeah,
And
she
I said
said
that
that.
I need to ask you some questions regarding your
Yeah, and I
condition.
said fine. That is fine, doctor.
But did she say I'm Amani, one of the surgical doctor working here?
She said that.
Okay, fine. That would be a very big mistake. I'm glad you didn't do it. Instead of did you, it's not did you lose, it's did you lose consciousness. If you wanna, because loss, if you wanna say, if you said did you lose, if you said did you lose, that's incorrect. It's did you lose your consciousness. There is no need for you to repeat your question. You asked one question twice. This station is very difficult. You need every single second. There's so many questions you need to ask. So don't repeat the question here in seizure. Be very quick. And use pre, intra, and after seizure. That will help you to quickly differentiate and ask about the most important information. Dose is not important. When he told you he had hypertension and diabetes and he's taking lisinopril and metformin, there's no need for you to ask about the dose for two reasons. Reason number one, you will have access to it anyway in real life in the system. And secondly, you don't have time for that. You wasted like 15 or 20 seconds. You better use this one for eyes or for systemic review. Don't ask about the dose generally. There's no need. You said when you presented your patient, you said she presented with right hand what? You said something right hand fitness. What did you say?
I said beginning right hand fitness, then says that right hand seizure. Here focus right hand seizure.
Okay. Neurological examination in the history, in the investigation, we didn't mention the neurological examination. I think you should start with this one. Yeah, neurological examination. And I asked you about the investigation. I wanted you to say the cardiac monitoring in your investigation. But overall, that's a very good history for such a difficult seizure. I will leave it for Muhammad.
Very nice presentation, Amani. I have 3 to 2 points. In the beginning of the station, Amani, the seizure we will ask before and during and after, right? I think you missed question about before, which is, did you experience any visual disturbance or hear any abnormal sound? And after, also you need to ask me about weakness and numbness in my leg to exclude brain tumor also. The last point, Amani, about your first differential diagnosis. Seizure may be status epilepticus, or maybe brain tumor. So in this scenario, I said to you that I lost 4 kilos in 2 months. So your main differential diagnosis is brain tumor, right?
لكن انت قلت لي 4 كي جي 4 months. انا ما برضه فكرت فيها
4
كده.
كيلو in 2 months.
والابيسود بدت من 11 in 2 months. ايوه والابيسود بتاعتك بدت ل 11 شهر.
6 months. No, 6 months.
Wait, Muhammad. Amani, try to speak in English. We are trying to we're trying to train all of you and ourselves just to be fluent on the exam, because your exam will be conducted in English.
Yeah.
Say what you said again.
He said that he lost 4 kilo within 2 months.
Yes.
And his
Yes.
symptoms started, I think, 11 or 7 months ago. This is episode of seizure.
6
And
months,
also, I
yes.
think this is not unintentional weight loss. This is it should be 10 kilo per month, right? Not 4.
But
Yeah,
the episode started just 6 months ago. So
Yeah,
it's getting worse day by
Yeah.
day.
You cannot.
This is episode started before loss of weight.
Amani, you cannot diagnose or exclude brain tumor just from the history,
Yeah,
as we said.
also weight loss not started with the seizure at the same time, Amani.
Okay.
Continue, Muhammad.
So I think this is all of my point, but she did very good.
Yes, so seizure is not an easy one. Yeah,
the,
what you want to say? Amani.
Okay, doctor, sorry. For Aura, I asked about do you feel any warning? Did you feel immediately any warning like chest pain or some feeling anxious? Or it is better to say visual or smelling like you say?
Yeah,
So
it's best to ask about the visual disturbance and abnormal sound.
Abnormal sound because I say chest pain and feeling anxious before the episode.
yeah,
And also,
Aura has different types. Some people feel visual disturbance. Specifically, they call it floaters, FLOATERS, like small bubbles coming through the eye. Or some people feel panic, which means they will have chest pain, tachycardia, and feeling anxious. You can just say, if there any specific feelings or sensation come to you before the seizure, like feeling anxious or some visual disturbance, you need to explain to your patient what do you mean by aura. You need to memorize this. If there any specific feeling that you feel before you felt before the seizure, like visual disturbance, tachycardia, or feeling anxious, you need to explain it in details to your patient. Okay.
Okay, thank you.
All right, good, Amani. Seizure is not easy. It does need a lot of practice. It's very difficult to remember. As we said, use pre-seizure, intra-seizure, and post-seizure. Pre-seizure, it is the first one, what happened before aura. Intra-seizure, what happened during the seizure. Any weakness, did you bite your tongue and the rest of the stuff. Post-seizure, post-ictal manifestation, wet himself or stool incontinence or whatever after the seizure. This will help you. If you just analyze the pre, intra, and post, you will have your diagnosis, and then you have the past medical history, drug history, social history, eyes, and systemic review. Don't waste your time. It's a very difficult and complicated station. All right, Muhammad iPhone. He will have the next station, which gonna be. Let me just double check. So Muhammad iPhone, Muhammad put the timer. I will be his patient. Your next station will be headache. Okay.
I'll put 6 minutes.
Yeah, put it for 6 minutes. And tell me when the timer is ready, okay?
So 6 minutes started.
Okay. Yeah, so, you know, Hana Noor wrote a very good sentence. Are you getting any unusual warning before seizure, like seeing flashlight or smell or a weird smell? Yeah, I think you can memorize this one and use it for the aura. It's very simple and very straightforward. Yes. So Muhammad, with the timer.
Okay, 6 minutes started.
Okay, hello, good morning. My name is Muhammad Hassan, one of the surgical doctor. May I confirm your name and age, please?
Hi, doctor. My name is John. I'm 40 years old.
Okay, nice to meet you, Mr. John. Today I'm going to ask you a few questions regarding your medical condition. Is that okay with you?
Yes, that's fine, doctor.
Okay. How can I help you, Mr. John?
Doctor, I had this severe headache that came from nowhere, and I never experienced such a headache before.
Oh, I'm so sorry to hearing that. It must be frustrating. Do you need me to turn off the light for you?
Yes, please turn off the light, give me paracetamol, and yeah, I'm in severe pain, doctor.
Okay, I will prescribe you. I will let the nurse to prescribe you a painkiller and will turn off the light for you. Now, do you feel better?
Yes, a bit.
Okay, can we proceed?
Yeah.
Okay. So please, Mr. John, can you tell me when this headache is start, firstly?
Like 2 hours ago, while I was playing, I'm a basketball player, and I suddenly had this severe headache, and I stopped playing, and I left the game in the middle.
Yeah. When did you first notice this headache?
As I told you, doctor, in 2 hours, like 2 hours ago.
Is it? Does you feel this headache before?
This is my first time.
Okay. Could you please cite where this headache do you feel it in your head?
It's here around my whole forehead and going to the back.
Yeah. Okay. Does anything make this headache worse?
Yeah, lights and moving around will make you worse. Noisiness also.
Okay. Does anything make this headache better?
Yes, what you did now, you gave me paracetamol. I feel a bit better now, and you close the light. I think that makes it a bit better. Yes.
Okay, nice. So, Mr. John, could you please rate this headache for me from 0 to 10, as 10 the worst headache you feel it in your life?
10, 10.
Yeah, I'm so sorry for hearing that. Mr. John, I would like to ask you, do you have any intentional weight loss recently?
No, my weight's been fine.
What about your appetite?
My appetite is fine, but I feel nauseous now, and I vomited like 1 hour ago.
Okay. Do you have any weakness in your limbs or any
No,
numbness?
no, I don't feel any weakness. No.
Okay. Uh, do you have any blurred vision?
No, I don't have blood vision. No.
Okay. So, Mr. John, uh, what about your water work system? Do you have any
Yeah,
problem?
it's fine. It's fine, doctor. I have no issue now.
Yes. So, Mr. John, do you have any medical condition?
Um, no, I don't have any medical condition. No.
Do you have any do you had any medical surgery? Any
No,
surgery?
no, I didn't have any surgery. No.
Uh, okay. Does one of your family have the same headache?
Yes, my dad has a kidney condition. There was multiple cysts in his kidney.
Okay. Okay, good. Uh, uh, do you have an allergy to any drugs?
Sorry? What did you? No, I don't have allergy. No.
Okay. So what? I would ask you further questions. What do you work, Mr. John?
Um, I'm a teacher, doctor.
Who is live with you at home?
I live with my wife.
Do you smoke?
Yes, occasionally. Not
How
occasionally.
many
Sorry,
cigarettes?
I smoke five cigarettes a day.
Okay, do you drink alcohol?
Yes, on the weekends.
Do you have a difficulty with the stairs?
No, tests are fine.
Okay, before I go any further, what do you concern about this headache?
I just want you to relieve this headache, doctor, please.
Okay, I will try my best. Do you have any idea, any other questions?
And my dad also died younger. I think he died 50. And I wish I don't die at the same age, to be honest. So
Okay, it's so early to say that. I'm so sorry for your dad. Please accept my my condolences.
okay.
Okay, thank you,
doctor.
Mr. John. Yeah.
Muhammad, how many times remained? Muhammad. Hello?
Yes. Time about 2 seconds. Could you please present your case?
Okay, I take a history from Mr. John, 40 years old male, complain of headache for 2 hours. Yeah, in all over the head, and it's severe headache.
Yeah.
And he has a positive family of a kidney disease.
What's
No
kidney
intention
disease?
weight loss. No intentional weight loss, but he vomiting one time.
Okay. What's your main differential diagnosis?
So my main differential diagnosis will be subarachnoid hemorrhage.
Okay.
And I also should consider.
What's your differentials?
I also should consider the brain tumor and meningitis.
What else? What else?
Vision problem.
Okay. What else?
Hypertension.
Yeah. What else?
You please skip this question. Should say this.
Okay,
No. Let him do that.
Make this question
I did that intentionally. What do you want to say?
Could you please, Mr., make this question at the end of my...
Okay, fine. How will you investigate your patient?
I should first do a full clinical examination for this patient.
Yeah.
And then I should do a general examination.
Yeah.
CBC, and I also should consider the renal function test.
Okay.
And I also should do a CT brain.
Okay. Anything else?
To exclude the brain tumor.
Okay. And how will you treat your patient? How will you treat your patient?
I should first treat the headache by giving analgesia.
Yeah.
Then consider the surgery,
Which is?
craniotomy.
Time up.
Time up. Yeah, he has just 2 seconds or finish. Time finished, but I will let you finish your answer, Muhammad.
Okay.
Yeah. By giving the diuretics and
okay, you want to give diuretics? You want to do an operation? What else? What diuretic you want to give?
I also should consider nimodipine.
Okay, nimodipine. And why you want to consider nimodipine?
Because it's a vasodilator. It's a cross brain barrier.
Yeah. And why you want vasodilator?
To decrease the blood flow, to decrease the amount of hemorrhage.
All right. And do you know what is coiling?
No.
Yeah, coiling is also a treatment for the aneurysm, which is endovascular treatment using platinum wires to block aneurysm blood flow. Okay, fine. Muhammad, good presentation. There's some points that we need to focus on. So it's not an easy station, this headache, but it was a straightforward subarachnoid hemorrhage. I made it very clear for you it's subarachnoid hemorrhage. You said, did you feel this headache before? You didn't say, did you feel? You can just ask me quickly, did this happen before? Is this the first time for you to have such a headache? You said something, but I'm sure you didn't say it in the right way. You didn't ask about any neck stiffness, and I don't think you asked about fever. So you didn't differentiate the meningitis, which is very important for you to differentiate. And even like if your patient has subarachnoid hemorrhage, he may have some meningism symptoms like neck stiffness. That doesn't mean it's acute meningitis, especially if it's just in 2 hours. So if your patient has fever or neck stiffness, that doesn't mean it's meningitis. You just need to differentiate by asking this question. That's very important. Yeah, you differentiated brain tumor. You didn't ask about the trauma, I think, any recent head injury. And I gave you the information that I have kidney vomit. I have a kidney condition which is a polycystic kidney disease. During your presentation, you shouldn't say he has a kidney problem. You should say I took a history. You said I take. You should say I took a history, not I take. I took a clinical history from Mr. John, 45-year-old, who presented with severe headache in background of polycystic kidney disease in his family, specifically his dad. He's presented with headache in the last 2 hours, and you finish your presentation. You asked me, I don't think you used the Socrates enough for the headache. You should ask me about the character. If you ask me about the character, I will say that like a thunderclap, which is very specific for subarachnoid hemorrhage, or I will say it's a very sharp headache. So the character, use Socrates for the headache. It's a pain. And as we said, we had a deal here. We said Socrates will help you differentiate any main complaint, even if it's a lump or a swelling. Use Socrates. Imagine if it's a lump. Socrates will help you by saying where is the site, what is the character of the lump, site, onset, when did it happen, character, radiation, any other lumps in the body. So Socrates is not just for pain. Use Socrates for every single complaint. It will help you in the exam and in the real life. As we said, your presentation, you need to practice more to be more fluent. And there's some grammatical mistake we need to get rid of. Like I take, it's not I take, I took clinical history. In your differential, you didn't mention two important differential, which is migraine and giant cell arteritis. Both are very important in your differential. When I ask you why you're using nimodipine, you should use nimodipine for one reason. It's a calcium channel blocker which prevents vasospasm. After every subarachnoid hemorrhage, a reactionary vasospasm will happen. That's why we give nimodipine. That's very important information for real life and for the exam. And I asked you about the coiling, which is also a treatment. Let me just show you something. I'm not sure if... Just 1 second. So that's the coiling. Do you see this picture?
Yes.
So that's endovascular coiling. Here, circle of Willis, right? And here you have the aneurysm. That's the coiling. Okay? You didn't mention refer to neurosurgery. I asked you what diuretic you want to give. You didn't say mannitol in your answer. You just said diuretics. You should specify and say I'm going to give mannitol. I think that's all from my side, Muhammad.
Nice presentation, Muhammad. I have a positive, and it is not negative, but it will affect your professionalism. I will start by positive. I'm so glad that you mentioned to the examiner that you would like to dim the light, and you arrange for a paracetamol. And the negative point about the
I'm going to use Google Meet. I think that's better.
okay.
Yeah.
Your first differential diagnosis, Muhammad, you asked about is brain tumor, right? You know this scenario go with subarachnoid hemorrhage. So start by subarachnoid hemorrhage to take the mark of professionalism. And Ali mentioned that he vomit once. Then you should ask about type of the vomit. Is it forceful or sudden? And it is subarachnoid hemorrhage, okay?
Yeah.
Okay. But you did very good.
As you know,
Thank
it's going to be projectile vomiting, right? Because it's increased intracranial pressure. It's not going to be a normal vomit, which will emphasize your diagnosis. Okay, Muhammad, let's move to the next. Who wanna participate for the next one? Amani Musa is still raising her hand. I don't think she lowered it from the start. We need new faces.
You will not master history and communication.
As you can see,
You need to practice.
Muhammad iPhone. Did you Muhammad? I don't want to call you Muhammad iPhone. Muhammad whom? Your name?
Muhammad Hassan.
Muhammad Idris. Muhammad Hassan Idris.
Muhammad Hassan. Did you know, like, studying from the book and practicing is totally different skills. So practice is the only way to master. There's no other way around it. If you studied from the book, that's not enough. All right. Who's practicing the next station? If nobody raises, Muhammad is still raising his hand. You can lower it down now.
We have Adnan. Unmute himself.
Did he raise his hand? Yeah.
No.
Yeah, I didn't raise my hand, but I was ready to do headache, but Muhammad has done it, so
No. Look on your Adnan, on your exam, they won't tell you which station you're gonna take.
But it's my initial preparation, so
which is totally fine. We are not here to judge anyone.
Yeah.
We're just here to practice and give you a feedback. That's it. So get into the zone, break the fear. There's no way. If you like, you're gonna regret it if you didn't practice now. So you're gonna practice it, Adnan, and your station will be
Unilateral tonsillar swelling.
Unilateral tonsillar swelling. Just get into the zone. Ask the question like what you do in the hospital, and we'll tell you at the end what did you miss, what did you do right, and what did you do wrong. Okay.
Okay, but like for start, actually, I didn't prepare this station. Like actually, it's like my first time to practice because as I mentioned, that it's first time for me.
Okay.
It's like initial preparation period. So
I don't want to push you hard.
no, it's okay. Like I'll try my best, but I have to really prepare well. But if I started now, yeah, it would be very bad. But yeah, I will try. Why not?
Yes, let's try. Yeah, good man.
Okay.
Muhammad, I will be his patient.
Okay.
If you can put the timer for 6 minutes.
So 6 minutes started.
Yeah, start now.
Hello, I'm Dr. Adnan, one of the surgical doctor working here. Could you please confirm your name and age?
Hi, doctor. My name is Ali. 55-year-old.
Nice to meet you, Ali. Today, like, I'm gonna ask you a few questions regarding your condition. Does that seem okay for you?
Yeah, that's fine, doctor. That's totally fine. Yeah.
Okay. Can I start by asking you how can I help you today? Like,
Yeah, doctor. I just have this swelling on my tonsil, and it's mainly on the right side. It's
okay.
getting bigger, and it's becoming like a problem recently. I want to get rid of it.
You mentioned that it is getting bigger. Is it slowly growing?
Yes, exactly. Yeah, slowly growing. Yes.
Okay. So you can you please remind me, like, when did you first notice it?
Around 6 months ago, but at the start I wasn't bothered too much, to be honest. And then it's like the size of it is getting bigger, and I'm worried now. It could be something sinister.
Yeah, actually, serious issues. Like, I'm sorry to hear that. Everything could be sorted out. Don't worry. Uh, could you please tell me, like, is it like anything? Is there anything makes it bigger or you know?
Yeah, that's a good question. I think the only thing that makes it bigger is time. It's getting bigger by time, but I cannot think of anything else beside time. So it's getting bigger by time.
Okay, so can anything stops it or?
No. I tried local remedies, but it didn't help.
Okay, so Mr. Ali, could you please tell me, like, have you noticed recently any like a change in your voice?
How did you know, doctor? I'm glad you asked this question. Yeah, my voice yeah, there's some changes. My voice sounds funny sometimes.
Okay, cookies. Like, before I ask that, sorry, Mr. Ali, I have to go back a little bit and
Yeah.
make sure that. Could you please remind me where is the location of the lump?
Yeah, as I told you, doctor, it's on my right tonsil. I told you at the start, it's on the right side.
So I had to recheck, Mr.
Yeah,
Ali.
fine.
Okay. Uh, could you remind me, please, like, is there any appetite change?
Yes, I eat less now, and I lost a lot of weight, doctor.
Okay, so it unintentional weight loss, or
Yes,
was
unintentional weight loss. Yeah.
could you please tell me how many kilos you lost?
I don't know exactly how many kilos, but my clothes doesn't fit anymore.
Okay, Mr. Ali. So uh, could you please, like, tell me, like, is there anyone around you felt unusual, like, unusual sounds, like, coming from you, especially while
Ye-
you sleeping or?
Yes. My wife complains that I snore a lot. I used to snore before, but she's saying it's getting louder recently.
Okay, so that brings us to that swallowing really, and it's very important.
Yeah.
Do you have any difficulty while swallowing?
Yes, doctor. Yeah. Unfortunately, that's why I came here. It's a big trouble for me.
I'm really sorry to hear that, Mr. Ali. Uh, do you have any breathlessness? Like, do you have any shortness of your breath?
Yes, sometimes. Yeah, especially while I'm sleeping.
Mm-hmm. Really sorry to hear that. Do have you been ill recently or?
I feel unwell generally because I don't eat much, as I said, because of the swallowing, because of the pain while I'm swallowing. But I don't have fever. It's not like I'm sick, but I feel unwell.
Uh, okay, Mr. Ali. That's that fever. Is it like, uh, night fever, or like
No. I don't have fever. No, I don't
you
have
don't
fever.
have fever at all?
No.
No, yeah, that's great. Uh, yeah. So you mentioned that you have difficulties with swelling. Is it painful?
Yes, it is.
Yeah. And you mentioned that you don't have fever, and you're like you don't have any like issues while like breathing. Is it
I
right?
yeah, I have some breathing difficulty, doctor. Yeah, as I said earlier.
Uh, really sorry to hear that, Mr. Ali. Okay. Could you please tell me, like, is there any cough there?
No, no, no cough, no.
Okay. Okay. So, Mr. Ali, what about tummy pain?
Um, tummy pain? No, I don't have tummy pain. No.
Okay. Okay. So, that that is like a very important section of
Time
our
up.
dialogue. Okay.
Time finished. Okay. Can you present your patient, Adnan?
Okay. I've talked with Mr. Ali, who has a complaint of a lump in his right side of his neck. And he mentioned that it is 6 weeks old and it is gradually increasing in size. And he also noticed his change in his voice and unintentional weight loss, which also affects his swallowing. It is painful swallowing, and also makes him breathless.
Okay.
Uh,
So from this
Also,
presentation, what do you think the most like? What's your differential diagnosis?
yeah, is my main differential is that he might have issues like with his vocal cord, like
Yeah.
tumor in his vocal cord, or might have tonsillar infection.
Okay. When you said tumor on his vocal cord, what is specifically you like? What do you mean?
Yes, adenoma, vocal like
Yeah.
adenoma. Yeah,
And
yeah, and might be carcinoma too.
okay. Um. Okay. How will you investigate your patient?
Yeah, in such cases where I have to like take a biopsy from the site of the lump and send it to biopsy flow cytometry to check if it is cancerous. And also I might offer like a CT to rule out any other kind of malignancy
Okay.
or a spread of the malignancy.
Okay. Any
And
other tests?
yeah, labs, especially when it comes to like total blood count and to rule out infection, and UNE to look for any decrease like oral intake,
Another test.
as if like and liver function test, because he mentioned that his diet is being deteriorated
Yeah.
recently.
Yeah.
And
You didn't ask about his occupation, but let's say he working as a carpenter. What does that tells you if he's working as a carpenter?
yeah, it might he might like got exposed to carcinogenic substances.
Okay, which will
And
cause what's the condition that wood dust causes? Do you know?
yeah, I'm not sure. I'm not sure.
Fine,
Like,
fine. How will you treat your patient?
Time up.
yeah, okay.
Time finish.
Can
Okay.
can I continue?
Uh, yeah, 3 minutes. Finish.
Yeah, it's
Okay.
like, can
Adnan,
I
that's
continue?
that's a good presentation.
Yeah.
Actually, like I didn't prepare the
Yeah.
station, as like it is. I'm in my initial preparation period, so
Yeah.
it was like a warm up for me. So it's
Yes.
like I was just watching the like
Uh,
and following up.
yeah.
So
Are you using a school?
uh, what?
Are you
Pardon?
using a school?
Yeah, I'm using school. Yeah, I'm using school. Yeah.
Yeah, I think you followed our structure, which is very good.
Yeah, I was
Okay.
trying. trying my best to follow it,
Fine. Okay.
you know,
Okay.
because I haven't prepared, so
Yeah,
it
that's
was
fine. So, Adnan, let me give you the feedback. That's a very good presentation.
thank you.
You presented yourself, you asked permission, you did all of the basic. Do you write while you're taking the history? Do you use a paper?
No, but I have the structure. Like you have to have the structure in your mind, and you have
Yeah,
to take it, the
that's fine.
positive, especially
Yeah,
positive.
and we don't ask anyone. We advise everyone not to write on the paper and just use their mind.
Yeah.
Um, um, okay, fine. You didn't have time to reach for social history, eyes, systemic review, past medical history. Social history here is very important, especially the job of the man working
Mhm.
as a carpenter, which may cause nasopharyngeal carcinoma, which is one of your differential. So you asked multiple questions and you repeated them. You should just ask once and move. And if I gave you the information, you don't need to ask me again. I said at the start, I gave you multiple information because you asked me an open question. I said
Mhm.
it's on the right side. You said, you asked me again which side. If your patient gave you already the side, you don't need to ask about it again. If he said it's on the right, then it's on the right, and that's you don't need to ask about it. This 10 or 15 seconds may help you reach the social history and ask about the job of the man, alcohol, and smoking, which is very important in such a situation. And as we say, social history is important according to to your station. If your station is knee pain or back pain, stairs is very important. If
Mhm.
your station is a nasopharyngeal carcinoma or uni tonsillar swelling, then the job is very important. Um, in your investigation, you started with the biopsy, and you came later on for the full blood
Labs.
count.
Yeah,
Yeah,
yeah.
for the
It's like labs is first.
yes,
It was a like, strategic mistake. I don't know how.
yeah, that's fine. As long as you mentioned it, you will get the answer, you will get the mark for it. You said CT to check for metastasis, but you should say PET CT, position emission
Mm.
tomography CT. So it's PET CT that we use. And then tonsillectomy for biopsy, pandoscopy, and monospot test. Monospot test to differentiate between it and glandular fever. So your differential is lymphoma or squamous cell carcinoma, peritonsillar abscess, glandular fever, and TB. You asked about the fever and you asked about the shortness, but I'm not sure why you asked about this. Did you consider TB in your differential?
I consider an infectious cause. Yeah.
Yes, okay. In your treatment, you should say MDT discussion because that's a very complicated. And then staging with MRI, CT, PET, CT, and ultrasound, especially for the liver because there may be a metastasis. Your treatment should be block neck dissection, radical, modified, or selective for the squamous cell for the nasopharyngeal carcinoma, and then at last you will have the radiotherapy.
Mm.
And let me ask you this question: what is the modified radical dissection of the neck lymph nodes?
Modified radical dissection.
Yeah,
It's like if it is dissection and it's radical, I think it's like something to do with like when they do the staging and it shows that there is a spread to the syncytial lymph nodes, they start to
remove them.
remove it.
Yeah, so
There is first and second and third. So
yeah,
it's
yeah,
like
so yeah, removal of level 1, 2, 3, 4, and 5, and
yeah,
if not, but spares the sub what they call it, the muscle. Remind me the muscle.
mm,
Sternocleidomastoid muscle.
Sternocleidomastoid muscle, internal jugular vein, and cranial nerve 9 lymph nodes.
yeah, all
That the one,
vital. Yeah,
yeah, that's what the one that you spares.
yeah,
But
it's
you take one,
unrelated.
yeah, you take 1 to 5. Fine, good.
Uh,
That's a very good start, Ali. I will leave it to Muhammad.
a good presentation, Adnan. I think you are trainer.
Yeah, it's like
Muhammad,
Yeah,
yeah,
yeah.
I'm getting
You
like
master
trained.
the station. Yeah.
Yeah.
I think your only problem is the time. And I did not
Mm.
allow you to ask about the social history, which is important here, because smoking and the patient job is important. But by practicing and practicing, you will master all this. Thank you for participating.
Thank you
okay.
for your comments. Thank you.
Thank you.
Okay, should we move to the next, Muhammad?
Yes. The last history station.
Last history, and then we have one communication. Anyone want to participate beside Amani? So Amani raised her hand. Anyone want to participate? Okay, let's go with Amani. Muhammad, if no, someone raise his hand. Muhammad again. Okay, both of them participated before. Anybody else? All right. So we have Amani and Muhammad. Amani gonna do the next history station, and Muhammad gonna do the communication station. Okay.
Okay.
Uh,
So with the 6 minutes.
6 minutes started. Okay.
Hello, I'm
Hel-
Dr. Amani Musa, one of the surgical. Sorry.
Yes, Muhammad, you are the patient. Okay, start, Amani.
Hello, I'm Dr. Amani Musa, one of the surgical doctor. Can I confirm your name and age, please?
My name is Sarah Johnson. I am 63 years old.
Sorry, your name again, Sarah Johnson.
Yeah, I am 63 years old.
Nice to meet you, Mrs. Sarah. I need to ask you some question regarding your condition. Are you okay with it?
Yeah, that's fine, doctor.
Could you please tell me what brought you in today?
Yeah, as you see, doctor, here I have noticed a lump in my neck and I have been feeling some discomfort.
I'm really sorry to hear that. Could you please tell me when exactly you noticed this lump?
Of course, doctor, it started gradually about a year ago, but it has been increasing rapidly in the last few months, doctor.
Okay. It started 1 year ago, right?
Yeah, gradually. Few months, doctor, last few months.
Okay. Okay. Is this anything make it better or worse?
Yes, doctor, stress make it worse and nothing make it better.
It is there all the time or come and go?
It is increasing and constant, doctor.
Do you notice any change in your appetite?
Yes, doctor. I have poor appetite and I lost a lot of weight.
How many kilo?
I'm not aware about this, but my clothes is not losing me, doctor, right? I lost, I think, about 10 kilo in the last 2 months.
Any hot intolerance or cold tolerance?
No, I didn't experience that.
Any change in your bowel habit like diarrhea, prolonged diarrhea or prolonged constipation?
No.
Any change in your sleep?
Change in my sleep, like what, doctor?
Like you're sleeping a lot of time
No.
or less sleep?
No.
Any change in your mood?
No, I didn't experience that.
Do you have any breathing difficulties?
Sometimes I have breathing difficulty, but this is not an issue. The main issue, doctor, I have difficulty swallowing.
Okay. Okay. Did you notice any snoring recently?
Sometimes.
Okay. Did you have any similar condition in the past?
In the past, no.
Do you see your GP for any other medical condition?
No, doctor.
You did any surgical operation in the past?
No. But there is the point, doctor. I think it is important. My family, I
Mm.
have a family history of thyroid cancer. I'm really worried about
I'm
this.
really sorry to hear that. Actually, I'm really sorry to hear that. I can appreciate your worry, Mrs. Sarah. Do you take any medication?
No medications.
Do you have allergy to any medication?
No allergies.
I want to ask you some personal questions, if possible.
Okay, that's fine, doctor.
Do you smoke?
Yes.
How many bags per day?
2 to 3 bags per day.
For how long?
You can say 25 years.
Okay. Do you smoke? Do you drink alcohol?
Occasionally, doctor.
Who lives at home with you?
My husband and 2 children.
Miss Sarah, what do you think the cause is?
I'm really worried about thyroid cancer due to the family history. Could you please help me and figure it out?
I'm really sorry for that. I appreciate your worries. We will try our best to figure out your problem. Don't worry. What you most concerned about now?
That is something serious.
What do you expect from us to do for you?
To figure it out, doctor, and treat me, please.
Okay, we'll try to do our best. Don't worry. Do you have any headache or blurred of vision?
No.
Any chest pain?
No. Time up.
Okay,
So
thank you for your time.
Okay, doctor, can you present your patient, please?
Okay, we'll present Mrs. Sarah Jones, 63-year-old female lady, presented with a lump in her neck. Started a few months ago and become more worse in the last month. She has poor appetite with weight loss, intentional weight loss. She has a history of thyroid cancer in her family, and she should smoke 2 to 3 bags per day since 25-year-old. My first differential diagnosis this could be thyroid cancer. Also, I will consider multinodular goiter, toxic multinodular goiter, or simple nodular goiter, or thyroiditis.
Okay.
And she has also compressive symptoms.
Yeah.
Symptoms in form of breathing difficulty sometimes and difficult on swallowing.
Okay. And how will you approach the investigation? What investigation will you request?
Okay, I will do full clinical examination for this patient, like triple assessment, full clinical examination, and ultrasonography for the neck imaging, and fine needle aspiration. And also we'll do blood investigation in form of thyroid function test and CBC, ESR, CRB, and calcitonin and radioisotopic scan.
Okay. Is a CT scan necessary?
In her condition, yes, because she has obstructive seizure.
Okay, she has obstructive seizure. Okay. What causes sudden enlargement? Give me 2 causes of sudden enlargement of a thyroid.
Okay, hemorrhage inside the cyst or transformation to malignancy.
Okay, and how will you treat your patient?
Okay, I will treat this patient. I will discuss this patient in MDT team. I will for malignancy in MDT team. We'll start by medical treatment like anti-thyroid drugs and beta blocker. Also, she needs surgery. In her case, if malignancy will be a total thyroidectomy.
You said anti-thyroid drug, right? What anti-thyroid drug we're talking about here? Can you specify?
Carbimazole and propylthiouracil.
Okay, what's the difference between carbimazole and propylthiouracil from a medical point of view, clinical use?
Can I discuss this question later?
Fine, yeah, good. Okay, you said surgical treatment, right?
Yes.
Did you
دائما.
mention? Okay, time up. But we're gonna continue. What will
Okay.
you counsel before, what will you say to your patient before the thyroidectomy?
Okay. Before thyroidectomy, I will take the consent after confirm that my patient is able to give consent, and I will tell him about the complication. The complication, first complication related to the anesthesia and operation itself, and complication post-operative, like prolonged use of thyroxine and hypocalcemia, or nerve injury. The cancer again nerve injury. He may have hoarseness of the voice, or aphonia, or snoring. Yeah, stridor.
And lifelong thyroxine dependence.
Yes.
If you can take the thyroid out, okay? All right.
Okay.
Mohammed, you can start your feedback, and I will
Okay.
follow.
Amani, excellent performance. Let us go quickly through your performance. You introduce yourself and get the permission. And in analysis of the main compliant, I think you missed one question. When you asked me about the difficulty of swallowing, I said yes. You need to ask me, is it painful or not? Because there are conditions like degrading thyroiditis may cause swallowing painful. It is occupied by goiter. And the differential diagnosis, you start to exclude hyperthyroidism first before the thyroid cancer. Am I right? You asked me about
What you said?
you started to exclude hyperthyroidism before thyroid cancer.
Yes,
You-
sir. Yes, yes.
Yeah, so in related to your professionalism, you should ask about the thyroid cancer first. Okay. Otherwise,
Okay.
in the presentation, you mentioned the main differential diagnosis and the other differential diagnosis. And I am so glad that you mentioned full clinical examination at the start of your investigation. And you categorize your investigation, which is blood investigation and imaging. So, excellent performance, Amani.
Okay, I just want to add 1 or 2 points in your grammar. You said, did you take any medication? You should say, do you take, because it's a present simple, right? It's not did you take any medication.
Yes.
It's do you take any medication? Always ask as
Yes.
present simple. Fine. We just okay.
The
But
last
otherwise,
station.
if you notice, Amani, your presentation now from previously is getting better day after day, even with
Yes.
just simple
أيوة.
practice. Okay.
Yeah.
أيوة الحمد لله. Even my grammar.
Yes. So, Muhammad, create last link, and I would like to ask everyone to stay with us to try Google Meet, because our next session gonna be Google Meet.
Ali,
So yeah, Muhammad.
let us show him the school before this station end to let him know from where they live.
I'm not sure if they know about you or no, but okay, we can show them after the next one. Let's create a new meeting
Okay.
for yeah. Okay, next meeting.
So, sorry, what's the scenario before I do the station?
Okay.
Yeah, we'll tell you exactly the scenario. Can you tell
The
us the scenario?
scenario is a 14-year-old girl with acute appendicitis is brought to the hospital by a neighbor. The mother, who is at work, becomes anxious upon realizing that the surgeon, Mr. Lee, is the same one who operated on her husband, who later passed away due to colon cancer. Okay? Introduce yourself and explain to the mom. Okay?
Yeah, let me just grab it. So, can you say the scenario again for me too?
Yeah, if a 14-year-old girl with acute appendicitis is brought to the hospital by a neighbor, the mother, who is at work, becomes anxious upon realizing that the surgeon, Mr. Lee, is the same one who operated on her husband, who later passed away due to colon cancer.
Okay. Do you understand the scenario, Muhammad, or you need more clarification?
Yes. What is the name of the girl?
The name of the girl, let's say Anna, and the name of the consultant who's operating on the girl, Anna, is Lee, and the mother of Anna is upset because Mr. Lee, she thinks he killed her husband
Yeah.
5 years ago.
Ali,
Okay.
you should
Yeah.
say the name of the
Okay.
mother because he will speak to her.
Yeah, name of the mother is Sarah.
Okay.
Okay.
So 9 minutes started.
Okay. Hello. Good morning. My name is Muhammad Hassan, one of the surgical doctor. May I confirm that I will talk to Miss Sarah?
Yes, doctor. You're talking to Miss Sarah. Can you please share what you know about? What do you know so far about my kid, doctor?
Okay. Unfortunately, I want to tell you that Miss Sarah, that your daughter is brought to the hospital by her neighbor, and that she was complaining of a severe abdominal pain, and now she in the operation room to do
Well,
a surgery
yeah.
for her.
But why? Who took her to the operation room, doctor, without my permission? I wasn't there, and to be honest, I feel guilty.
Okay, Miss Sarah, that's not your fault. You do not have to feel any guilty because these problems happen in anywhere and happen in any time.
But you said
So
you took her to the operation. What's your diagnosis, doctor? To rush her to the theater.
her condition is need to take her to the to emergency operation.
But what
She
is her
has
condition, doctor? What is her condition? Can you explain, please?
yeah, her condition is yeah, she complain of acute appendicitis.
Oh, and are you sure? Are you sure it's a acute appendicitis?
No, we did the general investigation to your daughter, and all the investigations suggest that it's a acute appendicitis, but we will not be sure 100% until we open it and see it.
Oh, okay. So, you take her to the theater before you confirm your diagnosis, and you cut her open just to confirm. That doesn't make sense, to be honest.
I'm so sorry. If you didn't get this point, I will repeat it to you. This all the investigation that we done and the examination that we done for your daughter, it suggests that's acute appendicitis, but there is nothing it's still that it's 100% an acute appendicitis. So it needs to be open to see if there is inflamed appendicitis. And do you know what's an inflamed appendicitis? And if there is any other if there is any other diagnosis rather than that, it's needs to take off this appendix and to deal with other diagnosis.
Okay. All right.
Can I ask you, Miss Sarah, do you know what's the appendix?
I don't know what's the appendix now. I
Yeah,
just
okay.
heard acute appendicitis, and I think it's a inflammation of the stomach or area around the stomach or something like that.
Yeah, okay. You are about near about the true answer. So this is the inflammations of part of the gastric or gastrointestinal system. It's it's a small part which is bulging or come out from the colon.
Okay, so it's inflammation for a part close to the colon. Okay, I get that, doctor.
Yeah.
Is it dangerous though?
Yeah, it's not dangerous, but it needs to emergency intervention because the patient will complain from of severe pain, and it needs to do emergent operation, and it happens in this age.
Yeah. Okay.
It happens in
any significance of acute appendicitis in my child per se, because she's young, and like, is it dangerous in children?
In children, because they hasn't a good fatty in their abdomen, inside their abdomen, so it may sometimes be dangerous, and we're afraid from complication in this condition.
Okay. And will the wound, doctor, will the wound be disfiguring for my daughter?
Do you mean the wound of the surgery? Yeah. We will make a small scar, or the surgeon, Mr. Lee, will make a small scar in her tummy.
Just hold a second. You said Mr. Lee?
Yes, Mr. Lee.
Okay. Okay. Let's have a talk about Mr. Lee after you finish what you're saying now. So,
okay.
Will it be disfiguring?
This scar, we will try. We will try our best to make a small scar that will not be obvious.
Yeah.
And do it by the plastic, and do it by the cosmetic technique.
All right. So it can be disfiguring.
Yes.
Fine. And is there any other problems that could happen?
I will tell you about the other complications.
Yeah.
It may have. It may affect the gonadal tube of your daughter.
By gonadal tube, doctor? What do you mean by gonadal tube, doctor? Why are you throwing
such terms
on my face?
The fallopian tube.
That's not nice, doctor. What's, like, give me something that I can understand. What do you mean by gonadal tube?
I'm so sorry for that, Miss Sarah. The tube that is the tube that is contain the or which is responsible for fertility.
Okay, fine. So my daughter will be infertile. Is that what you're saying? After the procedure.
These procedures may affect the one tube, but it's not necessary to happen. But if it's happened, your daughter has another tube which will be healthy and can produce.
Doctor, let's cut it short. Does your operation prevents my daughter to get pregnant in future? If that's what you're saying? No. All right. And let's go back to Mr. Lee. You mentioned, from what I remember, you said Mr. Lee. Are we talking about the same Mr. Lee that did a colon operation for my husband, Lee Anderson?
Yeah.
He did an operation for my husband and he died, doctor. I don't trust this man, to be honest.
Oh, I'm so sorry for hearing that. Please accept my deep condolences.
Yeah, but I don't trust him. I accepted your condolences, but I don't want my daughter to die with the same man who killed my husband.
Okay, Ms. Sarah. Can you please tell me more about the operation of your husband?
Yeah, he had the colon cancer and he died a few weeks after the operation, which was done by Mr. Lee.
Yeah, okay. So, Ms. Sarah, I need to explain this for you. I think your husband is dead due to the cancer, and this is a different situation.
Time up.
Your daughter now.
Time up. Okay, Muhammad, tell me, what do you think first?
About what?
About your presentation now.
I take a lot of time.
Okay. And you just practiced the history with us, and your performance was so much better than the communication, right? You can feel that.
Yes.
And I think because you are confident in the history, you are thinking the communication gonna be easy for you, right?
Yes.
Did you notice when you are practicing, like when you put on the on a spotlight, it's quite difficult. And that's what I say to everyone here. Please do not underestimate the communication skills, and do not read them from a textbook and think that you're gonna perform well on the exam. You have to practice the communication skills, every single one of them, multiple times. Because I'm sure you read it before. Did you read it before this station?
Yes.
And you know the answers. But when you are in the action, we're already gonna upload this video later on. You can see your performance. But from what I see, you need to practice a lot, Muhammad, in the
Yeah.
communication, especially in this one. You know the answer, you know exactly what you're saying, but you cannot communicate it well. Because I think
Yes.
you are confident that you know the answer, and communication skills is not that difficult for you. So you thought, okay, I'm not going to practice it, which is wrong. You have to practice multiple times. You
Yeah.
asked, you introduce yourself, you took permission. That will give you a lot of marks. You were very kind, you were very sympathetic. When your patient said, I feel guilty, you should say, you don't need to feel any guilt, not any guilty. You don't need to feel any guilt. When I asked you, could it be disfiguring, you said no. That's a wrong answer. You should say, we will aim for a small horizontal scar, but if there's any complication, like if we found the appendix ruptured, then we will need to make a disfiguring scar. So it could be disfiguring. You shouldn't give
Yes.
your patient false information. And you said your husband is dead, is died, which both wrong. You should say, I think your husband passed away because of this, or I think your husband died because of this. It's not is died. Is died is grammatically incorrect. And I'm not
Yeah.
sure, Muhammad, do you use our videos?
No.
Okay, so while you're working or while you're going to the hospital, I just want to show you something here. Just 1 second. Let me open the camera. I think that would be very helpful for the communication skills. Why cannot turn the camera? Yeah. So look here. Do you see this one?
Yeah.
Just 1 second.
Anxious and guilty women appendicitis. Scenario. A 14-year-old girl with acute appendicitis is brought to the hospital by a neighbor. The mother, who is at work, becomes anxious upon realizing that the surgeon, Mr. Lee, is the same one who operated on her husband, who later passed away due to colon cancer. Tasks. #answer. Ms. Anna's questions. #reassure Ms. Anna. Hello, Ms. Anna. I'm Dr. Lucidia, one of the surgical doctors. Can we talk about your child's condition? Yes, doctor. Can you please share what you know about your child's condition so far? Ms. Anna. I feel guilty. I work for long hours, and so far I don't know about my daughter. First, don't feel guilty. This could happen to anyone.
So look, I think you should utilize these videos. It's just 3 or 4 minutes. You can use them while you're going to the work, while you're not feeling to study. It's very convenient, and it will help you with the communication. And we have it for the whole communication skills, every single one: hematoma, splenic hematoma, all of them. Okay.
Splenic hematoma.
It seems very useful.
Yes.
The
So
patient's hemoglobin has fallen from 10 to 9, indicating potential ongoing. Surgical doctor responsible for Mr. Anderson's care. Use clear and empathetic communication to explain Mr. Anderson. responsibilities if he chooses to considering leaving the hospital. But before you make that decision, I'd like to discuss your case with you. Tell me, Mr. Anderson, what do you know about...
So use this one, Muhammad, and even this one will not be enough for you to pass the exam. You should listen to this video. It's just, look, this video is just 4 minutes, which will help you to practice, but you need to practice. You need to practice. This will not be enough. Okay?
Yes.
So I think that's when is your exam? May?
April.
April. Cool. Okay. So you still have time. So you're going to join us the day after. Please join us every single session we have, and make sure you practice the communication. And this is a message for everyone. You should practice the history. You should practice the communication. When I took my exam, I practiced the communication in the last 3 days, which was incorrect. I suffered because I was thinking that I know the answer. I think, okay, I know the answer. If the patient said this, I'm going to say that. If the patient said that, I'm going to say this. But when you put yourself on the exam situation with all the stress and anxiousness, it's going to be a very difficult situation. You are not on the exam now, right? And your performance declined because you didn't practice before. So you have to practice multiple times. All right?
Yes.
Muhammad,
Excellent, Muhammad. Just 2 points. I think you are struggling in the question of fallopian tube.
Yeah, I forgot to say that.
If you are struggling in any question that patient asked you, just draw it. Okay? And apologize for your medical terminology. You said fallopian tube, I think.
Yes. Because I think the answer should be more layman, as Muhammad say, or you can say, okay, Miss Sarah, let me just double check that for you, and I will be back in 5 minutes.
Okay. Also, another point, if the answer has probability of may and may not, when Ali asks you, will the wound be disfiguring? I think you said no. So it may be disfiguring. You may need to expand the wound, right? So answer in indirect way, but don't say yes. It will not be disfiguring. Because as you say, this is a dangerous condition in the children that may lead to the perforation. Otherwise,
yes, Muhammad. And for everyone here, I just want to say, it's not just for the communication. We have this video also for the history, by the way. For the history stations, we have video for every single history station, including seizure, infected pseudoaneurysm. All of these have their video. You can just listen to the station, which is going to take you 5 or 6 minutes because it's very efficient.
What's the color of the blood? It is dark red, doctor. How much blood do you notice every time? I can't determine the quantity, but it's not small. Is that bleeding painful when you pass stool? No pain. Is there anything that makes this bleeding stops? No.
Okay, so utilize this, please. I think that will finish our session for today, Muhammad. We're going to see you the day after. Tomorrow, we're just going to try. Okay, for everyone here, I want you to open your mic and tell me. We have Muhammad Hassan, who passed his exam in Abu Dhabi, and he after more than one trial, and he wants to give a feedback. So if anyone interested, please join us tomorrow, and it's going to be a quick session, especially for those taking the exam in Gulf area, Abu Dhabi, Dubai, or Egypt. It's going to be very helpful. Okay, we're going to post the link in the group. It's going to be tomorrow on 23rd. If delayed, we'll let everyone know. Okay. Good luck. Bye, everyone. See you next time.